So I am Dr. Carol McKinley Alvarez. I am the Chief Program Officer at Davis Street, and I am the person overseeing all programming here at our organization. At Davis Street, we have, we're actually considered a family resource center. So we have a plethora of programming, but the programming that is specific to us bringing in trainees or interns is our counseling program. And so that particular program has been established here for over 30 years in the population that is served. We have two parts to our programming. So we have a school base where we provide services inside the San Leandro Unified School District, whether it is elementary, the middle, or the high schools. And then we also have an outpatient clinic here on site. For the population in the schools, we are serving children anywhere from K all the way up until graduation in high school. And then here in the clinic, we also serve children, but the modalities are slightly different. We do individual, we do couple and family work as well. And our age range from 4 all the way up until the end of the lifespan. We have a federally qualified health center, which means that we serve people from a variety of backgrounds. So that's the same in which our counseling program. Individuals that we serve come from a very diverse background, both in race and in other areas of our identity, sexual orientation, inside their economic status, et cetera. And we also serve our clients from a very culturally informed perspective. We believe that the reason that we exist is because there are health disparities inside our communities, and those health disparities must be addressed by individuals who recognize they have to come from a diversity, equity, and inclusivity framework when providing clinical services. We also are very social justice oriented in the way in which we provide services. So when we are working clinically with the individuals that we serve, we're not looking at them isolated inside this one-on-one experience or 2 or 3-on-1, depending on if we're doing couple or family. We're looking at it based on the fact that they live inside a societal structure that is impacting them both on an individualized way, on a family systems way, and then on a collective way inside the communities that they live in. So our trainees, the primary work is to see the clients, right? That's the primary piece. Our internship is usually, or our trainingship is usually 16 hours. It can be up to 20 hours. If it's 16 hours, then they're going to have 10 hours of individual work. And then we're going to have individual supervision, group supervision, didactic training, and then documentation. We live by, if it's not documented, it didn't happen. And so we want to make sure that people understand that we support them wholeheartedly in documentation. We are a Medi-Cal site, and so there is Medi-Cal paperwork. And so we train our trainees on how to be able to complete the standards that are necessary in order to ensure that there's reimbursement as well. But those are the typical pieces: to see the clients, do the documentation, and participate in the clinical support that we provide, which is supervision and didactic training. Inside our counseling program, we actually have 2 types of therapeutic programs that we offer. We have our counseling program, which is connected to Alameda County Behavioral Health. Those referrals come directly through their access. We have an intake coordinator who facilitates that process. She gets all of the referrals and she does the assignments to our trainees. And then the trainees utilize the assessment strategies that we provided them. We have a clear assessment, a structured assessment process that we go through. So they go through that structured assessment process to be able to make sure not only we already know that the person meets medical necessity because they've been referred to us, but we're not simply looking at medical necessity. We're looking at whether or not we're a clinically appropriate site for them to be able to flourish in. And so that assessment includes that process as well. They meet one-on-one with their individual supervisor, talk about every single person that's been referred to them, go over the assessment, and then talk about, 1, is this an appropriate fit? If yes, what will be the treatment plan that will move forward. And that treatment plan is something that is established collaboratively with the client. It's reviewed with the supervisor, and then that is the process in which all of the clinical work is being evaluated from. Usually 10. So the typical caseload, if it's 16 hours, it's going to be 10. If it's 20 hours, it's about 12 or 13. But it is going to be 10 individual if they're in the schools, because that's usually all they're working with is one-on-one with the children. 10 diversity if they're inside the outpatient clinic, because they could have, again, that individual, couple, family, but it's still going to be a caseload of 10 if there are 16 hours. Supervision is designed around the trainee. So at the base, it's going to be 1 hour of supervision with a licensed clinician. That one-on-one happens in person. We have had to do virtual, right? So we have gotten accustomed to virtual as well. But if we can, we prefer to do in person. There's also ways in which that supervisor will come into a session, because we are on site. We are seeing most of our patients in person. So the supervisor will also come on site and at least do 2 sessions in which they are in the room observing the work as it happens. And then we also have weekly group supervision. It happens on Fridays. So for anyone interested, and hopefully people are interested, for anyone interested in coming to Davis Street, our supervision is on Fridays. Our group supervision is on Fridays, and it's from 9 to 11. And then didactic training starts at 11:15 until 1 p.m. So Fridays are the day in which it's mandatory for group supervision and for training. Individual supervision is scheduled one-on-one with the supervisor. So the training happens on Fridays. It's the didactic training. But prior to that, we do 2 weeks of training for new trainees coming into the organization, where they review the training manual. So we do have a training manual that gives all of our policies and procedures about what it means to be here. And so we go over some of the key components of providing good clinical care, which is we talk about providing care from a cultural framework. We talk about the necessity for crisis intervention, for suicide assessments. We go over all of those. We go over our process of assessment, our process for referral. All of those pieces are introduced in the very beginning. That's why we cover a 2-week training process. And then the didactic training are trainings that help to increase the trainees' knowledge. And so whether we're doing sand tray, we're doing play therapy so that they understand what it means to work with children, or we're talking about how to be able to engage parents with inside the therapeutic work, or we go over family systems work, but they're all targeted towards ensuring that the population that we serve here at Davis Street is something that this particular group of trainees understands how to serve and understands how to use that lens with inside their clinical framework to provide the highest level of care. So that's a really good question, because one of the things that we pride ourselves on here is that we like this to be a combination of working in a community clinic while simultaneously understanding a little bit of private practice. What I mean by that is we really need individuals who know how to work independently. You get a schedule. The schedule is made collaboratively between us and the trainee. Once that schedule is done, there's no one who's going to be, are you where you're supposed to be? What time is it? Are you running late? We expect that you will be here on site if you're supposed to be here on site. If it's 8 a.m., because our organization can do 8 to 8. So if it's 8 a.m., we expect that you're here at 8 a.m. If you're supposed to be at the school, it usually is more like 8:30, then we'll expect you're at the school at 8:30. If something has happened, there's an expectation that you contact us and let us know what's going on. And so there's definitely that you're a community clinic, which means that when you come in, if you're here, you're talking to the folks, the medical receptionists at the front desk. You're engaging with our basic needs staff, because maybe the client that you're serving today might actually need something out of our basic needs department. They they didn't eat today, they're not able to focus, they need some water, whatever it is. And so there's a definite community feel here. So we need people who are ready to engage in that particular way. Recognize that you're a part of a community system, that you're looking at not only the work that you're providing, but even the way in which you come into this environment, you're looking at it from a community grounded perspective. Also people who are very thoughtful and engaging and who understand that this work is heavy and it's important for us to do self-care. So if we look for people to recognize when they need to take a moment and to be able to process what's happening, or maybe they need a day off because they've been in the work every day and it's just so much for them that they need to take a mental health day. We love humor here. You may not be able to tell from me talking because I'm trying to concentrate on answering these questions, but we do humor. We love to laugh. We love to joke. And so one of the things that people will say quite frequently is that the behavioral health department, which is where the counseling is one of the lightest departments. We do the heaviest work, but we're one of the lightest departments because we believe in being very communal and very thoughtful and very engaged. So someone who can be an independent thinker, show up, be present, do your job, ask for what you need. Someone who will pay attention that, again, we work from a very equitable and inclusive frame, and someone who sits in a community-centered lens. That's kind of the best person who will thrive here. Everything else, we got you. We'll teach you, but come with those pieces. I think the population that we serve, because our referrals from Alameda County, we are moderate to severe. So the population that we serve is what people find most challenging, especially for our trainees who this may be their first practicum. And yes, we do accept people from the first practicum. And then we also have interns who are just getting their hours, right? We have the diversity of the ways in which people can show up in their training. So the heavy lift is getting comfortable being in a space with someone who's suffering and sitting in that space and not feeling like it's your job to fix them, but that it's your job to create that container in that space and be okay with that. So that we find is the most challenging. Our paperwork, no, we're electronic health records. People get that and they're able to flow with the paperwork pretty easily, but it's the patient population, because we're not an inpatient, we're an outpatient, but the severity of what people experience can be heavy. Well, we like CIS trainees. We used to get them all the time. And I used to get trainees back when I worked in the city over 20 years ago, and we were right next door to CIS, well, down the street kind of. But it is something about the diversity that you all bring. Do not close that off. Do not let the system shrink that. I love the diversity of your training and your thinking, because that's what's necessary for people who have experienced all levels of oppression and disparities. They need that diversity. So I think that's what I want you to know. Bring that, whether you're bringing some drama stuff, whether you're bringing all kinds of creative ways that you've learned to think about how we serve clients, or you're old school like I am, even though people would not believe it, psychodynamic. Bring it, and bring it in a way that allows you to show up in the fullness and the richness of who you are, because that's what helps our clients be able to live the healthiest lives. And that's what we build upon. If you need more strength around your clinical understanding, we'll be able to provide you that. We have skilled individuals here who do that every day for a living, but bring the authenticity of who you are and you will thrive here. That's it.